Hello again everyone, welcome back to my YouTube channel. This is Dr. Bhushan Sabnis. I am an orthopedic surgeon and a knee specialist practicing in Mumbai. And today I'm going to speak on half knee replacements or partial knee replacement, a subject which is very close to me and dear to me. I teach this surgery at various courses for various companies. Various courses in various countries, and indeed it's important for all of us to know the importance of half knee replacements in our current day-to-day practice. So as we have discussed before, arthritis happens when the joint lining tends to wear off or starts to wear off. In about 70% of the patients, this affects mainly one part of the knee joint. So if you consider a normal box standard patient that I see, someone who's 50 to 55, slightly overweight but active, has developed slight bow-legged deformity or varus deformity of the knee joint. Usually they have arthritis affecting only the inside of the knee joint, and in severe arthritis it tends to look something like this. So just imagine the inside of the knee being completely worn off without the arthritis affecting the outside of the knee. And that is seen in about 60 to 70% of the patients I see when they have grade 3 or grade 4 arthritis affecting the inside of the knee, but the outside is relatively well preserved. In such patients, I feel it's criminal to sacrifice the remaining good half of the knee joint just to do a total knee replacement. In such patients, a best option or a better option than a full knee replacement is to do a half knee replacement, which we are going to talk on today. So as I've said, the arthritis is affecting only the inner half or the outer half of the knee joint. Once again, 90% of the times is the inner half which gets affected. We Indians tend to have bow-legged deformity more common or more often as compared to the knock-knee deformity, which mainly affects the outside of the knee joint. So in bow-legged people, when arthritis is already affecting the inside of the knee and the joint lining is completely worn off, we nowadays only perform a partial knee replacement. So I usually advise this to patients who are young, fit and active, but at the same time I also offer this surgery to patients who are in their 80s and 90s, for this is a faster this is surgery from which you can recover much faster and get quickly back to your normal day-to-day activities without any significant morbidity as such. So half knee replacement involves changing the inside. It's also called as a resurfacing operation. In simple words, what needs to be done is 1 centimeter of bone on the inside at the end of the femur or the thigh bone, and top of the shin bone, there's a tibia, is excised and is replaced with a smaller implant which looks something like this. There are two main types of half knee replacement, a mobile bearing and a fixed bearing. A mobile bearing is an implant in which this plastic in the middle is mobile and moves from side to side, but I prefer this fixed bearing implant, which involves a socket which goes on the end of the thigh bone and a plate which goes on the end of the shin bone, and the plastic in between which is actually attached to the shin bone, forming a half knee replacement such as this. Most patients bounce back very quickly after a half knee replacement. About a couple of days after the surgery, most are walking confidently, initially with a walker, then with a stick, and within 2 weeks independently, going back to most of their normal day-to-day activities. Of course, the function that they have before surgery determines the function afterwards, but in my opinion, most patients who have successful half knee replacement are able to go back to almost everything they want to do, except sports, which I usually advise them not to engage in. But sitting cross-legged, squatting, walking as much as they want, climbing stairs, walking on uneven grounds are some of the activities they can easily perform without any issues. There was a famous study done to assess the biomechanics of a replaced knee, and it was found that a half knee replacement comes as close to normal as possible, and total knee replacement is completely different than a normal knee joint. So there is a score that we normally follow in patients known as forgotten knee score. That means the patient actually has forgotten which side was operated. And that is one of the best results that you can achieve following a knee replacement. The chances of a patient getting a forgotten knee score of 100 is maximum with a half knee replacement. So as much as possible, I like to preserve the remaining half of the knee and only change the damaged half of the knee by doing the partial knee replacement, which can be done on the inner side, the outer side, or indeed in the third compartment, the patellofemoral joint as well. So I think the way forward now is to do partial joint replacements and not doing the knee replacement, total knee replacement as the first go, and leave the total knee replacement as a reserve option. So I think it's important for all of us to remember that you don't need to sacrifice a good half of the knee just for we don't have any option. We have an option of a half knee replacement or a partial knee replacement and get back to your normal life or our normal life very fast and very effectively. So hope this was a bit informative for you. If you have any questions to ask, or if you want to contact me at Sportsmed Mumbai, or email me through my YouTube channel. Thanks for viewing this YouTube channel. Next week we're going to talk about total knee replacement as the treatment option for end-stage arthritis of the knee joint. Thank you very much.